Here we've got healthcare and retirement kind of lumped together. Anyway, lots of stuff to cover there, that's for sure. But again, we just kind of gloss over the top. One of the things we want to get into a little bit that the book doesn't is the Affordable Care Act. It was never meant to be economically sustainable. These are really smart people who put this thing together, and there's just no way they expected this to last. And I think that was because they expected that by that this was being the first step into establishing more of a single payer government run national healthcare system. But why wasn't it? What's the problem? Well, think of it this way. If you could buy house insurance after your house burned down, would you ever buy house insurance? Would you ever, if you could buy automobile insurance after you got into an accident, would you buy insurance? Beforehand, no, nobody would buy insurance until after the fact, right? And if the only people buying insurance had already had the accident, or houses had already burned down, or if you already needed the surgery, insurance could not exist as a business, because what insurance does is it pools risks together. And if you sell enough policies to homeowners, knowing that only a small percentage are going to burn down, you collect premiums. You got enough premiums there to cover the houses that did burn down, with enough left over for profits for your company. Well, that's what the Affordable Care Act doesn't do. It lets people buy insurance after they're sick. And so what's the incentive to buy insurance? Zero. The only way this can work at all, therefore, is to force everybody to buy insurance. And that's what the Affordable Care Act does. It forces everybody to buy insurance. It's the law. Used to be the law, I should say. That part was taken away. Of course, that was the keystone to the whole thing. If you don't force everybody to buy insurance, but even when it was the law, here's the thing. The penalty for not buying insurance was too low. The penalty has to be the same as the premiums. And that was not the case. And you can't give away too many exceptions. And that was another problem. There were lots of exceptions. So you had this leakage of people, usually the young and healthy, and they're the ones who have to be in this thing. They have to be in the pool to subsidize the older and less healthy. And that's the problem. And that's why it was falling apart. And that's why it's not economically sustainable. To be economically sustainable, you have to force everyone to buy insurance. And that presents a political problem. Well, as it explains in here, there's a political problem. And if you're forcing young and healthy people in who can't afford the premiums, and there was some help, for that. But anyway, that's why that never was going to last. And that's the issue. You must force everybody in the pool for this to work. And that was not happening. Well, when you've got health care provided to everybody, you've got to ration it in a different way than using price. Prices, there'll be an equilibrium. But when you've got a whole economy who has access to health care at a zero cost, marginal cost, now they're paying taxes and maybe very high taxes, but it's like a buffet, right? You've paid money to get in, but each time you go to the buffet to get some more food, it's free. You don't pay anything. And so if you've got a whole economy operating that way, you're going to run out of food at the buffet. Okay. It's not possible for everybody to receive all they want of healthcare. So it has to be rationed. And one of the means of rationing is waiting for it. In Canada, in certain areas, now I have friends who say they've never experienced this, but sometimes the wait can get very long. And well, here's a couple. Well, talks about this. Here's a couple of articles. There's who is it? Fraser Institute in Canada tracks waiting times in Canada. That's what this is. And Canada, an article there. I think the LA Times, proud of their healthcare system, but not the waits. It's like that guacamole, whatever. Something's going to come out. You make something that you say everybody can have access to. You got to wait. Now, I used to live in Fort Myers, Florida, and there's a VA hospital there. Granted, there's a lot of people, retirees in Fort Myers, a lot of veterans in Fort Myers. The wait there at the time I was there was 3 years. So, I mean, this can be quite long. And in Canada, the wait has gotten so long. In British Columbia, for example, they had to contract with Seattle area hospitals. They were so backed up. So they were sending their citizens over the border to Seattle. And Cleveland, from what I understand, is one of the hip replacement centers of Canada. If you need a hip replaced to be replaced and you're in a lot of pain and you don't want to wait the several months, you can go to Cleveland. From what I hear, that's a popular location. So there's always costs and benefits. It's not possible. Again, if you learn anything in economics, it's scarcity and trade-offs and opportunity costs, and it simply is not possible for everybody to have all they want of a particular good or service. If prices aren't rationing it, there's got to be another means to ration it. And in the area of healthcare, it is often in waiting. Time is your rationing factor. Then retirement. Here's a little thing. When I'm 65, I like the title, but here's the problem. As I say here, where in the world did this notion of retiring at 65 come from? Well, it came from Social Security in 1935. And there's no evidence that was scientifically picked for any reason. It was just picked. 65. Well, at the time Social Security came on board in 1935, life expectancy for men was 58. And so you died when you're 58, and then 7 years later, you got to get Social Security. Women, life expectancy was 62. They didn't have to be dead quite as long to get their Social Security as men. Okay, that's why it was very sound. Okay, the program was sound financially. But what about life expectancy today? It's well beyond 58 and 62. We're talking around 80, over 80 years old. So we've got a crisis in this country with people retiring at 65, even 62, and then living well into their 80s. They don't have the money. So this is just it's just total nonsense. I'm on my soapbox. Complete nonsense. The idea of retiring that young, unless you have saved. The thing is, people aren't saving. Too many people think Social Security is a retirement plan. It is not. It never was. It's just a supplement. Do not rely on Social Security. So, as I say here, today it should be more like 75. And I would argue even 80. But unless you have a reason, your health or whatever, your family doesn't live very long, I don't know. But otherwise, I wouldn't even think of retiring until I was at least 75. But this idea, this cultural notion, it's like graduating from high school. You go to 11th grade, 12th grade, then you graduate. Well, people turn 65, they graduate. It's just complete nonsense. Maybe that was fine in 1935 with life expectancies the way they were, but it doesn't line up with life expectancies today. Okay, a few retirement calculators if you want to play around with them. Anyway, that's it. That's all I have. I've rambled on for 10 minutes. Sorry about that. See you in the next module.